The question for this discussion is what causes inflammation in an acute injury, also how to mitigate inflammation in acute injury without the administering of non-steroidal anti-inflammatory drugs such as ibuprofen. It's a question I get asked somewhat frequently in the clinic, and people who ask the question are usually trying to avoid using an anti-inflammatory drug and are looking for an alternative option. The alternative option I'm providing is based on a nutrition intervention that is more specifically a tart cherry juice supplement that is intended to help with inflammation and reduction of free radicals, so basically acting as an antioxidant. To my patient, I respond, "This is a great question, and I'm glad that you asked it. You should know that as a PTA, it's not my scope of practice to prescribe or give pharmacological advice, but I understand your concern and aversion to non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen. I have some other modalities that I want to try in the clinic to help with the swelling and pain, but there may be some other options for you from a dietary standpoint that might address your current presentation. Pursuant to Colorado Natural Health Consumer Protection Act, I am required to tell you that I'm not registered, certified, or licensed by the state of Colorado, but that I do have graduate level education in nutrition and can advise you on certain dietary interventions that I'm familiar with from an evidence-based standpoint. The state of Colorado at this point does not currently have regulations for dietetics and nutrition practice. So to move on, if you're interested in hearing more about what I'm suggesting, I will start with inflammation. Inflammation is your body's natural response to an injury. It's intended to provide nourishment and immune activity to the involved area and in order to facilitate healing. Since this is a new injury, it's possible that your body is still trying to promote healing. With that said, though, the inflammation, if it's left unaddressed, can be detrimental and cause issues like secondary instability, muscle function deficits, and even a heightened risk for developing some scar tissue. So your concern is valid. We should definitely try to mitigate the swelling, which will hopefully address some of the pain as well. Wu et al. In 2012 found that tart cherry concentrates possessed antioxidant and anti-inflammatory attributes which may be of interest for your current situation. Reducing oxidative stress is important when you're trying to combat inflammation, and the high oxygen radical absorbance capacity of tart cherry products make them very effective at reducing free radicals, according to Wu et al. In 2012. Research from Transtador et al. 2009 demonstrated similar results and indicated that tart cherry juice was instrumental in improving resistance to oxidative damage with the participants in their study. Transtador et al. 2009 also mentioned that in part the reason for the success was due to the pigment compound, which is called anthocyanin, and they believe that to be a facilitator in eradicating free radicals. From an inflammation standpoint, Kelly et al. 2005 found that anthocyanins also exhibited anti-inflammatory properties through a 35-day trial that they did. In a follow-up study, Kelly et al. 2013 found comparable results over the same trial duration, but perhaps more interesting, though, was that they tracked more inflammatory markers in their follow-up study, which led them to believe that tart cherry concentrates could be used to prevent, reduce risks, or modify the severity of chronic inflammatory diseases like arthritis, diabetes, and even cancer. So with these studies I mentioned, there are some drawbacks. The methods they used to measure oxidative stress and inflammation were varied, so it's not necessarily a homogeneous representation of data. Furthermore, inflammation is sometimes a very subjective thing, and it's not easily quantified. So the claims that cherry juice reduced inflammation is derived from factual data, but it's not to say that cherry juice will reduce inflammation in every individual that takes it. As far as quantities go, the amount of cherry concentration consumed in these studies was equivalent to about 100 to 140 cherries 1 to 2 times a day, which seems like a lot of cherries, but the concentrates available allow you to dissolve this highly concentrated solute into an 8-ounce glass of water for easier consumption. It's obviously less cumbersome. An added bonus, I know you said that you were having trouble sleeping, is research from Hudson et al. 2011 found that consuming 2 servings of the dose I mentioned earlier helped improve overall sleep quality and duration in the participants in their study. So some good benefits, and if you're interested in trying it, I'd suggest starting with 2 servings per day, once in the morning and then 1 just before dinner, and seeing how you feel. Kelly et al. 2012 found that participants started seeing anti-inflammatory benefits by the end of the first 7 days. So I'd like you to keep in touch with me and follow up with your regularly scheduled appointment throughout adding this to your diet. And I do want to just be clear too, if you have any food allergies or things that you're aware of that may affect you from drinking the supplement, obviously we want to know of that. And then also, if you move forward with this, if you notice any signs and symptoms that are abnormal, like dizziness, shortness of breath, swelling of the lips or face, you should immediately stop taking the cherry juice and promptly seek medical attention. The last thing I want to mention about cherry juice and the tart cherry concentrate is that it's something that you can actually use prophylactically to reduce the frequency of muscle soreness after exercise or activities. I know you're a really active person, and if you've ever experienced pain or soreness after a hard workout or a long day of skiing, say, it's highly likely that the same physiological processes are occurring in your body. That is oxidative stress and inflammation. For example, Hawatson et al. 2010 performed a randomized double-blind control study in long-distance runners and found that not only did the athletes who consumed cherry juice maintain a higher percentage of their isometric strength after a marathon, but the researchers observed fewer markers of inflammation as well as increased antioxidant capacity compared to the athletes who consumed a placebo drink. So I think the cherry juice could be a great augment to what we're currently doing in the clinic. It's not a drug. It's all natural, and it could be good for you in the short term for your current presentation with the inflammation, as well as potentially giving you some long-term benefits and the prophylactic benefits of reducing pain and soreness and swelling after activities.